Hello, beautiful people. Welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. So, today's video is going to focus on medical jobs. So, we're going to be talking about medical coding. These opportunities are with Ensemble Healthcare Partners. So, they have multiple positions open. Primarily, these roles are medical coding jobs. So, and I know like medical coding is one that if you have the certification, you can easily be making close to 60 or $70,000. And that is really the reason why I wanted to do this video. These particular roles are paying between 25 and $27 per hour, which is a little bit higher than the average pay. So we're going to be diving right in. So let's talk about them. The first one is this one, which is titled physician coder. With this position, what they're looking for, obviously, you do need to have your experience of coding, and they're also asking for 3 years of auditing experience. So typically, auditing and coding tend to go hand in hand, and these are some of the qualifications or certifications that they are looking for. So you say candidates must have and keep current at least one of these following professional certifications. So you do not need to have every single one of these certifications to qualify for this position. All they are asking is for you to have at least one. So if you have a CPC or CCSP, you should be good to go. So, and this position, according to my research, Ensemble pays between 25 and $27 per hour. So again, this is a little bit higher than the national average for medical coders. So definitely one of the reason why I wanted to bring this forward. So with this role, obviously, you know that you're going to be doing a lot of monitoring, a lot of auditing to make sure that different account systems are reflecting the right information so that when providers or offices or doctors or whatever the case may be, they are putting in services that they've offered, the system can automatically bill with the accurate information to the insurance company. So that's really what this position is. So you are always going to be interfacing with the denials department, you're interfacing with operations and so forth. And you all know, like whenever there's an opportunity where you get to interface with multiple departments, I'm all for it because that just helps and opens a whole lot more doors when the time is right for you to do that next move over or even like growth in terms of career path. All right. So that is this first one. The second one is also another coding position, and this one is titled Revenue Cycle Hospital Coding Compliance Auditor. This one is a little bit higher than the first, and the reason for that, it makes a lot of sense, right? Because this is a compliance auditor. So compliance is a segment of healthcare that continues to boom. Compliance is responsible for making sure that everything that is services that is provided is up to par and meets regulatory requirements. So, what are some of those regulatory requirements? Some of you may have heard of CMS before. So, CMS is a monitoring body for Medicare as well as Medicaid. So, they are responsible, they basically have these rules that have been put in place to make sure that patients are getting the best of care from facilities, that insurance companies are not doing us wrong in any way. So these entities help to put rules in place that are sort of as a guide for insurance companies, for hospitals to follow so as to not do any violation. So if they miss any of these rules, oftentimes what results in it is fines. And a lot of companies do not want to pay these fines. So basically, you as compliance auditor is going to be making sure that Ensemble as an organization is following the rules and regulations, like the healthcare that they represent is following the rules as they should, so as to avoid that fine. So that's really what this is. As you can see on here, you're going to be managing, coordinating different compliance audits. You're going to be making sure that the records reflect accurate information, so as to so for the organization to pass a lot of audits that come its way. An example of such audits is CMS, that is an annual audit. In some cases, provide education to staff and other external representative. That is all this role is. So they do have active coding certification. They did not specify which one. They also talk about auditing or compliance certifications. but that is a preference. It's not required. And then previous experience in a similar role or experience in coding or coding auditing altogether. So that is the second position. Okay. And it's a fully remote role, and you do not need to reside in any particular states to be eligible. It says remote nationwide. The third opportunity is this one titled Facility Coding Auditor. This one, your focus is going to be on facility codes. So the way you have specific doctors, providers administering service. You also have facilities. Like when you go to an emergency room, for example, that is an entity, that's a facility. And there are specific codes for facilities, and those are often different from providers. So, this individual, you are going to be focusing on facilities. You're going to be focusing on the codes that are specific to the facilities, and these codes are what the facilities are going to use to bill insurance companies and so forth. Just kind of making sure that the codes are correct when the bills do go out. That's what this position is. This one is on the same average as the first one, which is the physician one, and they are asking for a little bit more years of experience for this. So 5 years, very similar to the first actually, and 3 years of facility coding experience. And then the next opportunity, which is also in the area of sort of appeals and stuff, is RON clinical appeals. The reason I added this position is because they are only asking for very minimum qualifications for this one. You do need 2 years of regulatory audit experience, and they are asking for you to have minimum education, such as a bachelor's degree as a registered nurse. They do have on here type 35 words per minute, which I found really interesting, right? So they have that here as well. This position pays almost up to $80,000 per year. That is this position, and it's open and accepting application. And this is for all the nurses that are interested in working from home and you don't want to necessarily be in the hospital any longer. This is definitely a position to think about, and this is a bonus role for this video. And then this last opportunity is contract modeling specialist. And for this one, basically you do need to have like some DRG type of experience, and that has to do with payment models. So how DRG is one form of payment model specific to CMS, to Medicare. But really, this is more related to payment, reimbursement, and so forth. So with this one, they are asking for you to obtain the CRO certification within 9 months of hire. So high school diploma is what they ask for. Then 2 to 4 years experience in healthcare relative to payer reimbursement. So that is really all they need for this one. However, you do need to have that certification within 9 months of hire. So if you know that you are open to getting that certification, which likely the organization would pay for, I definitely encourage you to go ahead and submit your application for this one. Okay. And this one is paying a little bit higher as well. And this one is paying approximately $50,000 to $60,000 per year. That is the salary range for contract modeling specialist. And this is a level one opportunity, which means that potentially as you grow, your salary, could get higher. So that is the roles for this video. So I wanted to talk about Ensemble Health Partners in this video because they have several openings right now, and they continue to have a lot of healthcare remote jobs that are open. And I wanted to make sure that I brought my viewers' attention to this organization since they always have healthcare roles in that are remote. So definitely check out their page. I would also include the career page to the description of this video so that you can actually easily access other opportunities that potentially may come up after I've done this video. Okay. So I hope you find these leads helpful. Give this video a thumbs up. Subscribe to this channel if you've not subscribed already. Till next time, I wish you guys all the very best of luck, and I will catch you in the next video. Take care, guys.